to respond to the press release and statement that we made this past Saturday on May the 9th. In that release, we highlighted the economic fallout that we are seeing here in Berks County among various businesses, but especially small businesses. And we noted next steps. Specifically, and I quote, we said that over the next several days, the Berks County Commissioners are going to secure input from healthcare professionals, the Chamber Alliance, and other business groups to develop a responsible and safe plan to reopen business in Berks County. We went on and said, quote, the commissioners also urge our businesses and residents to do your part to stop the spread. Reopening Berks must come with each of us taking responsibility to do so safely. That means we all need to do the right things to protect those around us, end quote. And then finally, we noted it will also require continued special precautions when it comes to those that are most vulnerable, the elderly and those with underlying conditions. Since that statement was released on Saturday, we've had numerous communications with business community leaders, the Chamber Alliance, our two major healthcare providers, and others. Today, we want to share the status of the business side of our research and planning. We looked at a number of different issues, but very quickly, we became aware of the issue surrounding the insurance clause, that virtually every insurance rider or policy has a clause that notes that that policy will no longer be in effect if the holder acts illegally or violates a law. We immediately reached out to legal counsel, our own insurance broker, and others in the community for feedback. And what we have learned is that at this point in time, it would be extremely risky for any business to go against what is currently in place relative to the governor's order. Let me make something very clear. The Berks County Commissioners, almost on day one, when the governor announced the life-sustaining businesses versus non-life-sustaining businesses, took a very clear position that we believed and still believe today that any business that is able to implement effective health and safety COVID-19 policy should be able to be open. However, the first block is this insurance rider. We're continuing to look at it, but based on the information we've received from legal counsel and insurance experts, it would be extremely risky for a business to violate or go against the governor's order. And here's the concern. If we said, go ahead and open, the reality could be that a small business has someone walk into their business, is injured, they face damages, and they find out they're not covered. And in opening their business and violating potentially the governor's order, they may end up losing their business, bankrupting their business because they're no longer covered. We were already aware of the licensing issues, and you will hear from one of our presenters the issue that creates, but the licensing is controlled by the state. It could be a liquor license with a restaurant. It could be a license relative to hair salons or barbers. George will likely address that, real estate license, and other licenses. And then there's the issue of state contracts. If a business is involved in a state contract, they could put that contract at risk, and if they have state funding. So the public may look at what I've said so far and ask the question, so what is Berks County going to do? Let me make something very clear. We believe that the governor's actions in choosing which businesses should be open and which businesses should be closed is arbitrary and capricious. We know from personal experience, hearing the stories of people that call us on the phone, people that have emailed us, people that have messaged us here in Berks County are suffering greatly, especially when we look at small businesses. Our businesses are struggling. But what makes it worse, Governor Wolf, is that we have small businesses that are closed while big box stores and competitors that compete with these small businesses are open. We have florists that are closed, jewelers that are closed, small clothing stores that are closed, pet groomers that are closed, computer stores that are closed, flooring stores that are closed. And so where do people go to get those things? They're going to the big box stores. And we're hearing more and more each day from many of these business owners that they are, in many cases, weeks away from shutting their doors for good, and some have already closed for good. Today, Governor Wolf, we are begging you to reconsider what you are doing to the Commonwealth of Pennsylvania and to Berks County. We are asking you, do you want to see our small businesses fail while their big box competitors can be open and take their business? Governor, do you really believe that a small flower shop is less safe than thousands of people flocking to Walmart and Lowe's for their Mother's Day flowers? We are begging you to revisit the rules that determine which businesses can open in PA. We believe that any business that can implement effective health and safety measures in line with the CDC and or OSHA should be allowed to be open. Governor Wolf, this ball is in your court. At this point, I would like to turn the press conference over to my colleague and Vice Chair of the Berks County Board of Commissioners, Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach, and thank you to everyone who joined this discussion this afternoon. I really think it's vitally important for the community and the business people in the community to understand where we are. We've heard from hundreds of small business owners who are suffering, and as Commissioner Leinbach pointed out, on the verge of failure, never opening up. This is the heart and soul of our community. The mom and pops in the main streets are what we are all about in Berks County, and we want to do everything in our power to help preserve that. And we're just imploring the governor. We understand you are under trying, difficult circumstances, but we're asking you to re-look at the life-sustaining and non-life-sustaining businesses. For those businesses who have already, before the official closure, were making efforts to keep their places safe. And so they can, again, start paying their bills and earn a livelihood in our great community. I was able to have three of my good folks that I do business with join us on this call today. The first one is Cindy Smith. She's the owner of Tails of Wagging, a pet grooming business in Spring Township. She joined us by phone. So if Cindy would like to give us a few comments on what she has done already about safety precautions and how she would staff her grooming business to help folks out there in the community who can't do it themselves.
Hello. My name is Cindy. Hi. I've owned Tails of Wagging in Spring Township for 22 years. We've been closed since March 19th. Even before we closed, we implemented safety procedures. We didn't let anyone in the shop. We went out to the car and got the dogs wearing gloves. We weren't wearing masks at the time because we weren't supposed to, but we will now, of course. Nobody comes in the shop. We only had three girls working at a time. I have 7 employees, 7 dedicated employees who just want to come back to work and take care of these dogs. Every day I come to the shop to take care of the 2 cats that live here. There is at least 20 messages on my answering machine. People begging me, people crying that please, when are you going to open? My dogs are getting matted. We do lots of Bichons and poodles that have long hair, and they're getting matted. Their nails are long. They can't see, and anal gland issues, and all we want to do is work. In addition to the financial hardship, I feel this is a really hardship for the dogs. Nobody seems to care about these dogs. This is part of their lives. It's part of their health and well-being, and we just want to take care of the dogs. And we will certainly take care of ourselves at the same time and our customers. Thank you.
Cindy, thank you for that urgent plea, not just for the pet owners and the pets, but your employees as well. We also asked Mark Ratcliffe, the manager of the Main Street in West Reading, to give us his perspective on the merchants on the avenue in West Reading. Mark, you've joined us video as well.
Thanks, Kevin. Really appreciate it. And really, this is just kind of an appeal to the governor. You know we need to have strict distancing and sanitizing guidelines, but we need to figure out how to start opening our small boutiques and restaurants. As Christian mentioned, if Walmart and Target, who see 100 times more business than our small businesses see in a week, can operate safely, then we know we can as well. Our restaurants are starting to fold under the lack of income, and not all restaurants are well positioned for takeout. We need to figure out a way to allow these restaurants to open safely, even if it's just outside, and allowing maybe 50% capacity inside. West Reading has developed a shop safe guideline for all of our stores to commit to. It's our promise to our customers that we will have hand sanitizers, face masks available, social distancing inside, and stringent sanitizing guidelines for all the stores. We have set up these guidelines using both national, state, and retail and restaurant association guidelines. You know, we would not encourage anyone to go out whose health is compromised or doesn't feel comfortable, but we need to figure out a way to get our stores open before they close permanently. It would be devastating for our area. West Reading has spent 20 years trying to build itself up to where we are today, and it will take another 20 years to bring it back up if this continues. Thanks, guys.
Thank you so much for those comments. Freddie Vasquez, founder and big cheese of FXV Digital Design in Wyomissing. Freddie, you're on the call.
Let's have somebody reach out from our technical group to Freddie, and we'll try to come back to him.
Okay.
Oh, Freddie, you are on? That's Freddie, unmute your mic. Take your cursor. Yeah, not coming through. Justin Luce or somebody from our IS, I believe they have a way to reach out to you. We'll try to get you back on before the end of the press event. Sorry about the problems there, Freddie.
Can you guys hear me now?
Yes.
Yep.
Okay.
Loud, clear.
I'm sorry. Okay, there we go.
Freddie, go ahead.
All right, sorry about that. Thank you, commissioners. My main issue for me, it's not necessarily financial as a business owner here in Wyomissing. Of course, everyone is hurting, and all my small business peers are hurting as well. The main issue that I am having and that I am seeing recently is that a lot of the mental issues that are happening here where I live. A lot of the problem is I try to call somebody every day, 1 or 2 of my fellow peers every day to see how they're doing, and the reaction is almost the same. No one is really doing that well mentally at this point. It's been about 2 months, And I'm starting to see that there's a lot of fatigue going on there. And we're not even talking about financial anything. I know that's a big thing and the reason why we're all in this space right now. But I was at a networking meeting last week. And when I came off that meeting, I felt like I was even more depressed than I was when I got on the meeting, because it's starting to affect so many people that their way of being has been affected. And I'm not trying to be insensitive to the people that have passed. I know it is a terrible issue that's happening right now, but we really need to start paying attention to the other things that are happening that nobody tends to bring up. Unfortunately, there's a lot of people out there with mental illness, and they need help just as much as the next person. And for me, myself, I have never been diagnosed with an issue like that. But when this has been happening, I feel depression settling in. I feel anxiety, and I can only imagine what it's doing to these other people in our society. And it's a real concern. And my other concern is that I have family members who have mental issues. I have to call them constantly to make sure that they're okay. Now, on top of all that, what about the issues such as domestic abuse? What about opioid addiction? What about ultimately, unfortunately, suicides that will be happening because of all this? I know everybody thinks that we're just here thinking, oh, you just want to open up your doors and make money. That is not the case. There is so much more at stake here that I think people just tend to just forget because it's not a statistic. And that is what's really scaring me right now. I have even had a conversation today with somebody saying that they went to go take their child outside, following regulations, and the child was scared. 4-year-old girl was scared to be outside because there was people around. That's the thing that's happening now. 60 days in, we have scared children that don't even want to go outside because of all the talk that's been happening. It is really just getting disheartening. It's not just about money. And again, I am not being insensitive to the people who have passed. I know that's a big deal, but there are other factors to think about, and nobody is bringing that up. Every day, it's how many people have cases today? How many people have cases today? What's going to happen when this is finally all over, and it's how many businesses have closed and how many people have unfortunately taken their own lives? How many people have died from overdoses who couldn't get help? How many times do you go on social media and see people drinking? They're drinking every day and putting a post about what they're drinking. Alcoholism is going to be a factor as well because of this. Everybody needs to stop thinking about the one thing that's happening. Nobody's life is more important than the other. No one's. You have to think of everybody. We have to go out there. We have to trust that we can do this safely. If I can go to Lowe's on a Saturday and there's 2 parking lots full, that's an issue. Because if you're that worried about social distancing and spreading the virus, they shouldn't be open. And Lowe's was packed. Home Depot, packed. Giant, packed. It is insane that that's okay. And me, a little marketing agency on Penn Avenue, can't have one person come in and talk about achieving their goals. That is an issue, Governor. You need to make some ramifications. You need to change this. It's no longer just about the people that are in hospitals. It's about everyone as a whole. We need to make sure everyone is taken care of. Thank you for giving me some time today. I appreciate it.
Freddie, much appreciated. Very much appreciated. Thank you for your passion with this subject.
Thank you very much, Commissioner Barnhart. At this time, I'm going to turn the program over to Commissioner Michael Rivera for some comments, and he also has some guests. Michael?
Thank you, Commissioner Leinbach, for your comments, and thank you, Commissioner Barnhart, for your comments as well. And before I get started, I just want to say, Freddie, the comments that you have are point on. I've had people reach out to me with the same concerns that you have, and a lot of times it's not an issue or issues that we address simply because there are a lot of times numbers that can't be measured in those aspects. So thank you very much for bringing that up. That's a huge issue for us here as well. So thank you. I appreciate your comments. Over the past few weeks, my office has gotten many emails and calls, and I want to thank those who have taken their time to write or call and share about their concerns. Please understand the health and safety of our residents is of the utmost importance to all 3 of us commissioners. I've spoken with people these past few days about the reopening of the county. I have emphasized the points that Commissioner Leinbach spoke about earlier. We're looking to develop a safe and responsible plan, one that will help our businesses and at the same time will ensure the health and safety of their employees, their clients, and our residents. One that makes sense for the long haul, because we don't know how long we're going to deal with this. So we can't look at it what's right for today or for tomorrow, but we need to work on a plan that makes sense for the long haul. And to accomplish that, we need to reopen the right way. And that is what we want to do. But it's not only about reopening the right way. We need those businesses that are currently open to do their part as well. Because a business is open doesn't mean it is following the proper health and safety guidelines, and we need to make sure that they are. Just the other day, someone was telling me that they went to a fast food drive-through and the girl at the window had her mask under her chin and the cooks were talking to each other over his food with no mask on. Although it's an essential business, they are not following proper health and safety guidelines. So we can reopen and stay open, but to do it, we all need to do our part. Let's be clear. A business that is open because it is considered essential does not necessarily mean it is following proper health and safety guidelines. Most do, but some don't. Is an essential store that sells non-essential items any safer than buying those items at a specialty business that is following the proper health and safety guidelines? Probably not. Would you rather send your mother or father to a big box store to buy something when they can get the same thing at a smaller local store that is following the proper health and safety guidelines where there are less people? I would. Do you feel safe going into a business simply because it is considered essential even though they are not following the proper health and safety guidelines? These are questions that we all need to ask ourselves. Am I saying that big box stores are bad? By no means. I use them all the time and they are important to our economy. But there are small businesses that are dying and may not open up again, and they are also important to our local economy, to our downtowns, to providing specialized services or goods not provided elsewhere. Essential versus non-essential should not define who should open, but rather who can open in a way that maintains their employees and clients and the residents of Berks County safe and healthy and can help mitigate the spread. It is up to all of us to do our part to help stop the spread and to take extra precautions to protect our most vulnerable. And I also have three speakers that I'd like to present. The first one is George Fortis, and George is the owner of the American Barber and Beauty Academy. And I'd like George to say a few words in reference as to what his issue has been and what he sees his industry is doing and would be able to do to help keep their clients safe and healthy. George? Do we have George on the line yet? I know he was on, maybe having technical difficulties. While we get him set up, then let's move on to hear from Mark Moan. Mark Moan is a realtor. He's the past president of the Reading Berks Association of Realtors, and he's the Public Policy Coordinating Committee Chair for the Pennsylvania Association of Realtors. And I'm going to ask Mark to share a few words about the real estate industry, what they're doing, and why it's important for the governor to lift the ban on real estate agents showing properties. Mark?
You have to unmute. He's showing muted right now on my screen, and I think that's what's wrong with George as well.
Yeah, George and Mark, you have to unmute.
Somebody jumped off. Yeah, all three of your speakers are currently muted.
Okay, Tim, are you able to unmute? Okay, hello?
Justin, are you able to jump in and take a look at this? Or is somebody on the producer side able to unmute Tim Profit, Mark Moan? And I don't know which number is George.
It's Tim Profit. Can you guys hear me?
Yep, go ahead, Tim.
I'm sorry, Tim, let me introduce you, and before I introduce you, I'd like to ask Mark Moan and George Fortis, if you're still on the call, if you can hang up, call back in, and do not mute your phones. Maybe hopefully then that way we'll be able to get you on the call after Tim Profit is done. And I'd like to introduce Tim Profit. He is the president of Savage Auto Group. Tim?
Hi, commissioners. Thank you so much for having us. We'll wait for those two guys to go. But, you know, this is a complex problem. And early on, I think we're all on board with one thing, right? And that's saving lives. So, you know, 8 weeks ago, we had very, very little information. And, you know, we weren't able to do much but sit back and be as careful as we can be. But 8 weeks later, we have a lot of information. We have a lot of things that have shown us which direction maybe we should consider taking. And, you know, I'm just a small business. You know, I own several businesses outside of, you know, my partners with the Savage Auto Group. And, you know, they're all struggling. But the one thing I will say to everyone, because a lot of people challenge me, I have a perspective I think is a reasonable one, but some people differ from me. And the one thing I say to everyone is we can do both. We don't have to choose between protecting someone's life and someone dying and us, you know, salvaging a portion of our economy to be able to sustain a mildly normal. You know, we don't have to sit back and say we have to let people die in order to open up business. That's not true. We can do both. We can do it effectively. And now some people are hearing this and say, Tim, there's no way you're right. I feel completely differently that, you know, we open up, we're going to have loss of life. Well, I would argue with one simple statement. If that is absolutely true and you feel differently, then why aren't all the Walmart workers dead? Because you can take proper safety precautions. I can put 3 or 4 people in my showroom. And right now, as an auto industry, I would consider essential from a repair standpoint. And then we were opened up online sales for you know, the general public, help people that really need a vehicle, except those rules that are in place unfairly punish the lower income people that can't afford to make a $30,000 mistake. These people cannot not test drive a car and if their only form of transportation and realize they made a mistake. There's a certain percentage of our population that can take a $30,000 hit. I'm not one of them, but I'm sure there are people that we know that can. The vast majority of us would need to drive the car to make sure our car seats fit in, to make sure that our family fits in. And if we made a $30,000 mistake, that would pretty much bankrupt us. So there are ways to do both. And I just want to echo that and not let go of that statement because it's absolutely true. No matter who you are, you can do both. And if you argue and say you can't, give me the reasonable response of, then why aren't all the first line workers dead? Because you can. I'll leave you with that we can do both.
Thank you, Tim, very much for your words. And I agree as well. We need, as long as we do things responsibly and everyone does their part, we can do both. Now I'd like to ask George Fortis, are you back on the line? I heard you call in.
I am. Can you hear me?
Perfect, George. I can hear you perfectly now. Again, George is the owner of American Barber and Beauty Academy. And George, I'd like to open it up for you to share your thoughts with the group.
Yes, thank you for the opportunity. Yes, so I'm the owner of American Barber and Beauty Academy, formerly just the American Barber Academy. And we are actually still under construction and plan to open up this year in the new Lancaster Avenue Plaza owned by Schumann Development. So with regards to just business in general, you know, I'm very grateful for the PPP loan that I know a lot of businesses were taking advantage of. You know, the one thing about the PPP loan is that it is great for businesses, but businesses that opened up this year, or in our case, business model that has changed essentially with different types of expenses, the PPP doesn't take that into consideration. They take into consideration old finances. So new businesses, I feel for the new businesses that just started this year that don't have an opportunity to take on that PPP and get some assistance. So that's a challenge. But with regards to our industry, we are a school, so there is classroom time involved. But we do operate just like a barber and beauty salon. So we represent our school, but also barbers and beauty salons. A lot of the local barbers and beauticians will and have come from our school. So we hear a lot from them directly. A lot of them reach out for advice and guidance on what's going on. And a lot of barbers in general are self-employed people. And with the status of the unemployment system, a lot of them still to this day haven't received any funds. And I know how that can be challenging for people who weren't able to have a rainy day fund. But as barbers and beauticians, we are part of our license, and what we practice every day is sanitation and infection control. As part of our schooling, it's something that we already do on a regular basis. So there's the precautions that we already take, plus what we know that we're capable of doing. We know is gonna be safe and allow us to protect our employees, our students, our clients coming into every day getting services. There's things that we can do to limit infection. So that's pretty much all I had. But temperature checks, masks, sanitation tables, things that are already all the big box stores are already doing. We're just as capable of doing it, and we really see no difference in what that we're exposed to opposed to a normal cashier or anybody else that are operating right now.
Okay, well, George, thank you very much. I appreciate your time and being here on the call, and thank you for hopping off and calling back in so
yeah, sure.
you can speak here. All right, now the third person who I'd introduced is Mark Moan, and I believe Mark was able to get back on as well. Mark, are you on?
I am. Can you
Okay,
hear me?
perfect. Mark is the past president of the Reading Berks Association of Realtors and Public Policy Coordinating Committee Chair for the Pennsylvania Association of Realtors, and I've known Mark for quite a while now, and he's done a great job as a realtor. So, Mark, do you want to share some comments with us?
Sure. Thank you, Commissioner Rivera, for having me on board. Yeah, the big thing for us, obviously, real estate is very much an essential business. Department of Homeland Security earlier in April issued that statement that real estate is essential as part of their guidelines. And right now, we are the only state out of 50 where real estate services are not deemed essential. Real estate is a very, very simple business for us to take CDC guidelines and safety precautions. Most of our membership is readily prepared, wearing gloves, masks, booties, having wipes for any touch surface in a home. We're ready to do whatever we need to do. We can limit numbers of parties in a property, so we could have one or two other consumers with us when we show a property. Open houses aren't a requirement. We don't need to transport consumers in our own personal vehicles. Usually that's done in their own vehicles these days. So our in-person physical contact is very, very limited. And the reality of it is there's really no reason for us not to be practicing real estate services out there right now, like every other state in this wonderful country of ours. The economic impact of the shutdown specific to our industry, we just have to turn to the boom and the crash and see how long it took this economy to recover from 2008. And, just case in point, through the first 12 days of May, there were 68 residential units that closed in Berks County. For the entire month of May in 2019, there were 549. So even if we double the 68, you're looking at 300 less closings in 1 month. That's 600 families that are impacted by real estate being shut down. This isn't about a sale. This is the impact on your neighbor, on your friends, on your family. The governor himself, when he issued the mandate preventing evictions and foreclosures, he said housing is an essential need. It's really, really difficult for Pennsylvanians to shelter in place when they're not able to find a place that they can call their shelter. So Governor Wolf, you need to open up real estate services. You need to protect your small businesses. The economic impact of what you're doing will bear negative repercussions for years to come. And I urge you to open up in a safe, cautious manner so that this economy can recover in a productive way and we can stop the panic that's ensuing and resulting in closing of businesses, losing of licenses, the shattering of the American dream of home ownership. Thank you.
Mark, thank you very much for your comments. And as you can see with the 6 presenters that have spoken, all of them have had concern for the health and for the safety of their employees, of their clients, and of the residents of Berks County as well. So it's not about doing one or the other. It's about doing it so that both can be done together so that we can have our businesses open, but also at the same time maintaining our residents safe and so that we're able to get through this situation. Like I said earlier, we don't know how long this is going to go on. So we have to start doing things in a way that we can start reopening our economies, reopening our counties in a way that's safe and healthy and secure for everyone, but we cannot continue to wait for this. Thank you, Commissioner Leinbach, back to you.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. And I want to thank each of our presenters. I would ask our presenters if you're able to stay on the line in case there are questions that are directed to you. I would appreciate that. If you can't, we understand. Before we go to the questions, I want to highlight a couple of things. Number one, I want to reiterate that we made a commitment to begin the process of planning, and we have started that process. At the very beginning of our press event, I explained that today we're focusing on the business response, and we expect sometime in the next several days to focus on the healthcare and medical response. The message that we want people to get today is we are not giving up on reopening Berks County. We are calling on the governor of Pennsylvania to do the right thing and to allow businesses that have the ability and are willing to implement effective health and safety standards to allow them to open and to especially understand the plight of small business in Berks County. It's not that I don't care about the rest of the country or rest of Pennsylvania, but my job and our job as commissioners is to focus on the needs of Berks County. I want to share a statement. All 3 commissioners received a letter this morning from Dr. Tam of the Children's Clinic of Wyomissing. And something he said really jumped out at me, and I'm guessing my colleagues as well. He says, after reviewing Governor Wolf's plan for reopening Pennsylvania, I and other members of the healthcare community believe that it is unreasonable in its expectations. In the name of saving lives, the livelihoods of so many people who are being negatively affected. Dr. Tam makes the case there is a relationship between saving lives and livelihoods. I also want to reference another doctor, Dr. Ed Mahalik, has spoken to all 3 commissioners in the last several weeks. Dr. Ed is the head of our Mental Health and Developmental Disabilities Department, and he has warned each one of us that the longer this economic shutdown goes, the more likely we are to see a spike in suicides. This is a real issue. We are committed to, I believe what Tim Profit said, that we can do both. We can continue to save lives by proper and effective health and safety measures, but we can also save the lives of our small businesses. I want to take a moment and, before we go to questions, share a chart. This chart was released yesterday by the Pennsylvania Department of Health. I already have looked at some of the questions, and some of the questions are asking, how can you even be talking about any business reopening in Berks County? The numbers are so bad. This is from yesterday. This shows that of all the counties in this grouping called Southeastern Pennsylvania, Berks County over the last 2 weeks has had the most dramatic decrease in cases day over day. Berks Countyans are flattening the curve. They have flattened the curve. We need to continue to do the right things, but please do not assume that Berks County is out of control. Berks County is doing the right thing. Berks County businesses and individuals, and we need to let businesses open that can implement effective public health and safety standards. Let's go to questions, and I can see both of my colleagues, so I'll read the question, and if you want to jump in, just raise your hand and we'll turn it over to you. We'll go as quickly as we can, and I will not read questions that are redundant, because right now we have 30 in the queue. I have a small business in Kutztown. When can we start opening? I follow all of the guidelines for COVID-19. We hope that can occur soon, but right now we are not setting a date because we don't believe that is wise. It would put your business and other businesses at risk. The next question is a great follow-up on that. How are you going to continue to put pressure on the governor and the administration to move this county forward and stop holding us hostage to misrepresented numbers? I understand your words, but what are you doing behind the scene? My heart is breaking for the economy of this county and this entire state. What can we do? This is a constitutional crisis. I think the final outcome is not going to be good. Well, number one, the commissioners have primarily been fighting behind the scenes. We have, and I have copies in front of me of a letter from late March to the governor on the construction industry and the ridiculous nature of saying that outside construction can't be done safe. At the beginning of April, we said to the governor, it's time to pivot and recognize that businesses that can implement effective public health and safety policy should be able to open. On May the 1st, we sent a letter similar to Dr. Levine and challenging the statistics and cases should not be the way they determine which county opens and which one does not. Commissioner Barnhart, I'm going to look to you to talk a little bit about what we're doing with our state and national associations and the call that's coming up tomorrow.
Sure. So we actually had our first call with CCAP with the governor jumped on with Dr. Levine. So we talked about.
Explain CCAP.
County Commissioners Association of Pennsylvania, I apologize. So Governor Wolf got on in the beginning, recognized the plight of the counties and how difficult it is for county commissioners, and then turned it over to Dr. Levine, who spoke about the health portion of it and contact tracing, testing, and those sorts, and actually testing in all the nursing homes. I have been on the phone at least every day, if not every other day, with our Southeast representative of the governor's office. And she assured me this morning, she recognizes Berks County is not going rogue or turning our backs on the administration. She completely understands that, and so does the Wolf administration. But she said they're also actively looking at this life-sustaining, non-life-sustaining business format and see if they can't make some changes to it. And I think the whole focus of today is to recognize that we have some disagreements, some sharp disagreements with who's allowed to open and who's not allowed to open. And we're really today focusing on that. And as we move forward into our weekly media events, we're going to be discussing other factors. But today is focusing on opening in a safe and productive manner.
Commissioner Rivera.
Yeah, just to add to that as well, we've also been engaged with the Greater Reading Chamber Alliance and other business associations as well, working together with them and giving them support, letters of support, and supporting what they're doing in their outreach to the governor as well. So we've been working on a lot of different fronts to be able to try to get this move forward.
There are several questions here on why we're more worried about small businesses than your citizens. And I will tell you that is simply not true. We may be the only county that launched a program several weeks ago educating our businesses and educating our individuals on what they needed to do to protect themselves. And we did that at a time that the big box stores and the grocery stores overwhelmingly were ignoring any type of practical and effective policies. That's why we highlighted at that particular event the Weaver store in Fleetwood Lions store, because before anybody told them, they had implemented effective procedures. We are not more interested in businesses. We are interested in our citizens and our workers and our businesses. And as we've said all along, we can do both. We can protect lives and have proper procedure, and we can open up our businesses. Why are you not pushing for the federal government to protect states and small businesses and pushing to make sure the testing and contract tracing are in place rather than pushing Governor Wolf to put citizens at risk? I know I'm unwilling to go out to these businesses without those measures in place. The contact tracing is being worked on with our county and other counties. We are working with the state and the federal government, and also we're working with private contractors. Agree that businesses can reopen safely. Isn't the real risk of prematurely moving to condition yellow, removing stay-at-home order, and allowing groups up to 25 to gather before it's safe? I will reiterate, at no point has the county talked about the governor's system of red, yellow, and green. We have simply said that businesses that can open up safely should be able to open up safely. We've not dealt with any other aspect or made any suggestions on those other items. Commissioner Barnhart, this is a question for you. Kevin, have you set up an appointment with Governor Wolf to work with him on what small businesses can open earlier than June 4th?
Well, as I said, I've been in almost daily contact with the Southeastern Director, and on Friday, the County Commissioners Association has a call at, I believe it's 3 o'clock in the afternoon. We actually have to submit our questions ahead of time, and then they're fielded by Lisa Schaefer, our Executive Director, to the governor's. The governor's actually going to be on the call, recognizing we're working hard, he's working hard, his administration's working hard. For me to have a one-on-one sit down with the governor, I would love to have that. I really would, but I'm sure there's thousands of people in line ahead of me. Everything we can do to try to collaborate with the administration, we are doing as a county.
One of the things I will add, we are effectively lobbying the governor right now, telling the stories of the businesses that you've heard from, and we intend to continue to do this until Governor Wolf understands the plight of our local economy and businesses and recognizes that if they can open up safely, they should. And you can help, and there's several questions here, you can absolutely help by contacting the governor, contacting your legislators, and asking them to reach out on your behalf to the governor to tell your story. When I get a letter like I did from Dr. Tam or another email today from an owner of a small restaurant in West Reading, or an email on Monday from the owner of a tanning salon that has put her life savings and everything she has over the last 25 years into that tanning salon, and she doesn't know how she's going to reopen. Those are the stories that we need to be able to share through whatever means possible. What will you do about people who feel fine but are contagious and don't know it, like 40 to 50% of the cases? I'm not sure where you're getting your information. If they're not being tested, I'm not sure how we would know that 40 to 50% of the cases. Or about the fact that being in an enclosed space for any prolonged period of time negates the effectiveness of social distancing and the 6 foot apart rule. What are restaurants going to do to protect patrons from these things? I would encourage you to go to our website, doyourpartberks.com. There's a link near the top that says, here are what businesses and individuals can do. And for businesses, there's a link to specific CDC business guidelines, specific OSHA guidelines from the federal government on what businesses can do to effectively mitigate the spread of COVID-19. And there's also a document there from the U.S. Chamber. I would encourage you to please look at that. And I'm just trying to go through here. Is there enough testing available in the city of Reading where it seems that the virus is spreading rapidly? And do we have contact tracing teams available? That is being worked on right now. We have been working through our Department of Emergency Services, and I believe, let me look here, Brian Gottschall, are you on the call here? Yes, he is. Brian, can you jump in and talk a little bit about the testing, some of the challenges and limitations, and that we're working on the contact tracing?
Yes, Commissioner.
Introduce yourself, please.
Yes, are you able to hear me?
Yes.
Great. I'm Brian Gottschall, the Director of Emergency Services for the County of Berks, and have been working with the commissioners and the other folks in the leadership team since the beginning of the response efforts. So we're working on a number of different aspects of testing. One of the ones that many people are hearing about is antibody testing. Very early on, we secured antibody test samples from a firm in Southeast Pennsylvania that has expressed an interest in working closely with Pennsylvania based governments over and above other governments throughout the nation. In essence, because they're local, because they're manufacturing local, and because they have an interest in supporting Pennsylvania, it's our hope that they will be able to provide us larger volumes of testing cartridges than other folks might be able to. And folks that are listening may have heard on the news, this is the company that Chester County has been working with closely in their efforts. It's a complicated process because we don't have a built-in health system in Berks County. Because Chester County had that capability, they've been able to work a little bit more quickly to make that happen. We're working with both the company who is going for their FDA emergency use authorization, and we've also gotten in touch with a law firm that Chester County had helped us to facilitate contact with, that they worked in order to negotiate the contracting with laboratories. So that's kind of where we're at with respect to antibody testing. But it's very important to understand that antibody testing is not even being accepted by any federal or state authority as being a means of diagnosing the disease. It's a means of establishing how the disease is spreading in the community and where people may have current immunity or evidence that they've had the disease either in recent or distant past. The other kind of testing, the kind that is very common that most people are familiar with, is RT-PCR testing, where they use a nasopharyngeal or oropharyngeal swab in order to take a sample. That sample then gets sent out to a laboratory, and that is truly the diagnostic test that is used to determine if somebody is COVID positive. That testing has not been easy to come by almost from the beginning of this event. The sampling media and swabs that are used to transport the sample to the laboratories has been in short supply, and that's part of the reason that from the get-go, Even though we were hearing, if you want a test, you can have a test. In reality, from the beginning, there were some pretty stringent guidelines around who was going to be tested. People had to have known or suspected exposure to someone positive, and they also had to be displaying symptoms. That has lessened somewhat, and we see more testing sites being open. In a conference call we just had yesterday with the Department of Health, they specifically named a location in Berks County that they believe is going to be coming online to providing public RT-PCR testing. So the testing process is moving forward, but it is difficult. There's no doubt about it.
Okay, continuing. Again, I'm not going to stick to statements. I'm just going to go with questions. Again, we will be talking about our conversations with health professionals in the next several days. Today, we were focusing on businesses, why we're not setting a date, and what we're continuing to do to work with those businesses. Do the Berks commissioners have a breaking point at which they will consider more decisive action than just please? If we reach further into June or are still kept in red status, then what? Just let all the small businesses fail? Is there no consideration at all how churches are vital to the health of the community? Two things. Number one, churches are not bound by the governor's life essential versus non-life essential. They never have been barred from being allowed to meet. Some churches in our community are meeting in their parking lots. Many of them are meeting online, and that is a decision that individual churches, parishes, mosques, etc., will need to make. Secondly, if we had an answer, and we are looking at other possible answers to the insurance question, we would encourage our businesses to go ahead. But we don't have an answer to that question. We don't have an answer to the license question. Of course, even though we haven't talked about it, we know that the CARES money that was authorized by the federal government for counties all across the United States, for whatever reason, the federal government deemed that unless the county had 500,000 people or more, that money would be administered through the state. In Pennsylvania, that money is controlled by the governor, and that is another potential risk. Commissioner Barnhart.
Yeah, so you brought up the CARES Act, and that is something I'm in constant communication with the governor's administration as to when and how we apply for that portion of CARES Act money to come to Berks County, similar to our bigger neighbors to the southeast, Chester, Montgomery, Bucks, Lancaster, and Philadelphia, Allegheny, and there's 7 of them that received direct allocations. Lancaster alone received $95 million. They are using $36 million for testing, for contact tracing, for PPEs they've purchased, about $7 million for first responder reimbursement and COOP planning, and $53 million for economic recovery. Problem is, for us to threaten and then execute a, hey, everyone go back to green in Berks County, we will suffer the consequences. And I don't want to be the one saying that, gee, I held up the money or we were denied money through the CARES Act because of a foolish decision.
We have a question. Will we get a copy of this session? Unless somebody has copied it or videotaped it, no. BCTV, I can tell you, .org is covering it, and they normally keep a recording on the BCTV YouTube channel. So I would check with bctv.org. Again, I'm looking here. Anyone can answer this. Mark, this is about the real estate comment. The only state out of 50 where real estate isn't essential. Don't you think this shows that the Governor Wolf has a hidden agenda here to keep us down the wrong path? I don't know, Mark, if you want to answer that.
Can you hear me?
Yes, we can.
Okay.
Mark Moan
it's-
from Reading Arbar.
Yeah, from Reading Berks Association Realtors, also Remax of Reading, and I'm tied to the state association a lot as well. And it certainly the concern is, does it come off as there's a personal vendetta against the industry? And that's not true. It's just the governor is expressing his issues in regard to his beliefs and following his plan in regards to the recovery. The main part of me being on today's call was to as PAR continues to state, we can practice our industry. We can do everything in real estate safely. And because we are such a prime motivator to the economy overall, it's foolish for our industry to be shut down when we can practice safely and efficiently.
Commissioner Michael Rivera.
Yes, and to add on to what Mark is saying, in the real estate industry, it's not just about the livelihood of the realtors, but it also has to do with the finances and the livelihood of the county and of the municipalities as well, because real estate transfer taxes are a part of the finances of each of our municipalities. So the longer this goes on, that is also having a financial impact on our municipalities as well at that level of government as well as on the county. Again, not something that should be taken on by itself, but just another reason as to why the real estate industry is very important.
Thank you. Question from Tom Rader from WFMZ 69 News. What if a small business owner wants to open, but employees have safety concerns? Well, I have news for you. That's been an ongoing concern the day the governor said these are life essential businesses and these are not. We've heard off and on from employees, from family members of employees that have had concerns. And what we ask them to do is to go to their employer and ask to see what the effective health and safety plan is to deal with COVID-19. That's what the CDC recommends. That's what the PA Department of Health recommends, that a business that is allowed to be open is supposed to be doing the right things. And again, I can tell you there are a number of businesses in Berks that are doing the right thing, but that's an employee has a safety concern. They need to go through their business and talk to them about that. Another question, how do you expect the economy to recover if people do not feel safe going out to these businesses, spending money because of the hardship everyone is facing? Well, I don't want to sound like a smart aleck, but people are going out and spending money. They just happen to be spending the money in big box stores and grocery stores, Target, Walmart. So instead of buying the flowers from Centerport Flower Shop, they're buying them from Walmart. That's the reality. We're simply saying, be safe. If a business can open safely, it should. This is from Shelley. Why do the county commissioners feel it's appropriate to ignore the direction of health experts and CDC? Not only do we think that's not a good idea, we have been promoting the CDC guidelines, the OSHA guidelines. They have been something that we've been promoting for the last 4 weeks to businesses and to individuals. Tom Rader. Also, when do the commissioners think the county can move into yellow phase? And do they have any plans to do what Schuylkill County is doing and defy the state orders and move themselves into the yellow phase? We've made that pretty clear. We've never talked about the phases. We are pressing the governor to allow any business to open that can implement effective health and safety standards to mitigate the mitigate COVID-19. And there's some compliments here, but I'm just focusing on questions. Why did you not have any workers or worker representatives on this to give their perspective? Great idea. This is Chris from Reading. Let's mark that down. And I think that would be great to have some workers give their perspective as well. Charles Thompson, and I believe he is from the Patriot News. I missed the beginning. I understand your dissatisfaction with the state's progress, but you are not declaring a unilateral breakout from the plan and Berk's red status today, and that's correct. And I emphasize again, we don't care about red, yellow, and green. Our focus has been public health and safety. If a business can open and implement effective health and safety standards. Again, there's various declarations, and I'm not going to take multiple questions on the same thing. We all want small businesses to reopen safely. Whose responsibility will it be to provide them with the equipment necessary to reopen safely? Will the government be providing those materials, or will it be a further burden on our small business owners? Number one, I would ask anyone that asked that question, who provided that for the big box stores and the grocery stores and the Life Essential? Overwhelmingly, that was provided by the businesses, and we have been told again and again. In fact, I've heard from no small business that said, I can't reopen because I don't have the equipment, I don't have the material. All of them have told us the opposite. We've worked with our association, we've worked with our insurance people, we know exactly what we need to do, and we're ready to do it. The commissioners keep repeating we can do both, but no evidence is offered to support that position. What in the world are you talking about? That gets so frustrating. Business after business have shown that they're following CDC guidelines, that they're following OSHA guidelines on the effective health and policy standards. It's out there, it's there for you to read. I can't make you read it, but it's there. Michael, Commissioner Rivera, this should be for you. My real estate clients are in a predicament, and I was thinking of this too. It's not just about county government and revenues and municipal government and revenue or the realtor. My clients are in a predicament. They sold their house a day or two prior to the shutdown in the settlement. The settlement is approaching and they have nowhere to live. They're military veterans, and their house settlement they sold has to be sold by July 10th date because the woman buying it has to be out of her apartment. How is my client who sold supposed to find a home and get a mortgage approval, et cetera, and inspections and appraisals before July 10th?
And that is a good question. And if, Mark, are you still on the line there?
Yes, sir.
Mark, would you be able to clarify that? I know you're more actively involved than I am. You're more aware of what the current guidelines are around that. There are some limited exceptions, so can you go over that, please?
Absolutely. So if they had been under contract prior to the March 18th deadline, they should be, due to most recent governor rulings on those sorts of things, the fact that they were under contract before that specific date and time, they can then actively go out and show homes to them, subject to proper guidelines. And as we had discussed earlier, what I would recommend to that particular person, to that particular agent, if they are a realtor member, to call their real estate association, call Reading Berks Association of Realtors, for some clarification, just to make sure that what they are doing is in accordance with the governor's guidelines as stated. It is very, very much tied to that specific date and time, and that's why the concern and confusion exists out there, is because if you did something on one day, you can practice in this certain way, but if you did something the very following day, the exact same action, then you're not able to do that. So contact the Realtors Association for more clarity, or you could reach out to the state association as well for the same sort of clarity.
Okay, thank you, Mark.
Thank you, Mark.
You're welcome.
Brittany, have the commissioners received any communications from the governor's office in regards to requests to reopen? There have been no formal responses to any of our communications to the governor. And in fact, I think all three of us were on the CCAP call with the secretary earlier this week, right? I'm looking at Kevin. Michael, were you on that call?
Yes, I was.
Okay. The governor, unannounced, jumped on the very beginning of that call. I think Commissioner Barnhart referred to that. And the comment from many of us, we couldn't comment, we were muted, so we couldn't comment publicly. That's the first time the governor, since this whole thing started, has even engaged the County Commissioners Association. Part of the real problem here is that the governor and the administration, including the Department of Health, has never taken the time to talk to county leaders, municipal leaders, and say, this is what we're thinking about doing. How will this affect you? And working with us. Everything that we've been told has been dictated to us. And often we've heard it when the public's heard it in the media. Even the most recent communication where we sent a copy of the letter to Dr. Levin to the governor, we didn't get a formal response back. Instead, the Reading Eagle spoke to the governor's office, and on last Thursday's article, I believe, a headline article, the governor responded through the Reading Eagle to tell the commissioners that he wasn't going to make any changes. Commissioner Barnhart, I know that you've had, and you've referenced it, and you may want to talk about that, conversations with the staff, but there has been no effort for them to collaborate with us.
And as the governor mentioned that on the call on Monday with Dr. Levine, was we need to be in contact with our regional representatives, and that's what we're doing. We're going through the regional office in Philadelphia, which she covers about 8 counties. So I can, at the very least every day, we're on a call. Sometimes it bears fruit, sometimes it doesn't. Last Friday, I got on the call and was very concerned or upset about moving into June 4th as a potential moving to yellow, and the primary is June 2nd. So that has caused a real flood of people quitting as poll workers and losing polling sites. People are not willing to go out to that extent. So just a plug here, you can apply for a mail-in or an absentee ballot up till May 26th. Please apply for a mail-in ballot, because we're faced with a June 2nd primary. We have no control over the state mandate to have a June 2nd primary, and our Election Services Department is working feverishly and overtime trying to make this thing work. We've been given an untenable situation that my hat's off to our Election Services Department and others for stepping up to do the impossible.
And again, I will reiterate, Commissioner Barnhart, there was no collaboration when the date was set for June the 2nd. Nobody asked us at the county level, is this doable? What are your challenges? It was made and we were told you got to figure it out.
Yeah, and I'm hoping that the path forward is more openness and collaboration. Back middle of March, I think it was, we got a phone call an hour before we were told we were going to be closed down, that we're going to be under the stay-at-home order. So that's the kind of pre-warning we get sometimes, but it seems like it's getting better. And again, if I call her every day and she calls me back, there's always something we can talk about and try to discuss. And again, the focus is the CARES Act and the testing capability for the county.
The next one is from Sam. Commissioners, how can you guarantee now is the right time for Berks to reopen? without securing widespread testing for our community, particularly those working in nursing homes. Two things. Number one, if you look at the decision on the life essential versus non-life essential, those businesses were open and nothing was put in place for several weeks for those businesses to protect their employees or to protect the customers. What we are saying is we only support the opening of businesses that would implement those effective health and safety procedures, and only those procedures that are already approved by CDC and already approved by the Pennsylvania Department of Health. I have to believe that if those are approved procedures, they're approved because they do indeed mitigate what's happening with the COVID-19 spread. Sam also mentions the nursing homes, and that is an important note. If you look at the deaths in Berks County, the overwhelming percentage of deaths, probably in excess of 98%, excuse me, are individuals that are elderly and or have underlying health conditions. I said this on feedback this morning on WEEU. I am not minimizing the tragedy of the loss of a life, but overwhelmingly, that is the group. And that's why on Saturday, in our statement as commissioners, we recognized that going forward, that population needs to be protected. Secondly, the overwhelming case count is in nursing homes, not just in Berks County, but across Pennsylvania. I know that Brian Gottschall is still on. Brian, do you have any of the data at your fingertips relative to nursing homes here in Berks and nursing homes overall? Because Sam is correct that nursing homes are a major area of concern.
Commissioner, can you hear me?
Yes, I can. Go ahead, Brian.
Okay, I don't have it at my fingertips, but it is publicly available to anyone on DOH's website, and I'm going there as I'm speaking rather slowly. DOH on their website, where they post the demographics regarding cases, they indicate in each county how many cases are located in nursing homes. So presently in Berks County, there are 23 facilities that have at least one positive case. Of those facilities, there are 693 residents who are currently positive, 93 cases among employees, and there have been 119 deaths in those facilities. And again, that data is directly from DOH's website and is available to anybody that would choose to go there.
Thank you very much, Brian. There's several questions here again. Why are we ignoring CDC guidelines? We are not only not ignoring them, we are imploring people to follow them. That's the whole essence of doyourpartberks.com. We've actually made adjustments. As we see adjustments in the CDC guidelines, we made adjustments in what we've said on that website. And we also are linking directly to those resources so people can go read for themselves what the CDC says. If a business is on the verge of collapse and decides to take a risk and open, aside from insurance and licensing concerns, can you talk about what Berks County is doing to soften the blow? I've heard some stories about Berks County not enforcing certain aspects they have control over. Can you talk a bit about that? I believe what you're referring to, the only authority, and it's not the county proper, is the district attorney. And District Attorney John Adams has been pretty clear and pretty public that he is not enforcing a business that is open, that is supposed to be closed. He's not enforcing that. However, and this is a big caveat, this morning I believe he emailed us as commissioners and let us know that he is working to cite a business that is flagrantly ignoring the health and safety standards. I don't even remember the name of the business at this point in time, but so that's a separate area.
It's one of those skills parlors where those games of skill are played
That's right.
and people congregate around the machines. And actually, the other people in the community said it's about time something's done about that.
And we continue to have one person asking why we're making decisions contrary to the CDC. I can't say anything more than I've said. We are not, and we will not. I normally don't read comments, but I'm going to do that. Susan said the giant that I go to counts people at the door to limit number of people. Could you ask the governor to do that for big box stores? Personally, I don't go to the big box stores now, nor will I go to any busy business when we open up. Susan makes a very good point. We said this before even the governor called, and I guess the country called for people to wear masks. We said to people, if you go to a store and you walk in the door and you see employees not wearing masks and customers not wearing masks, and you don't see social distancing, turn around and leave because you're not safe. And Susan, you're right on the money. We shop with our feet. But again, we also can do the same thing with Governor Wolf and let him know that, for those of you that agree, that small businesses that can implement effective health and safety standards should be able to open. And again, these standards are OSHA standards, CDC standards. Can someone ask the governor why it took so long to implement testing at senior care centers? If testing was available 2 to 3 weeks ago, why is he waiting until next week to begin testing? Brian, unless you can answer that, I can't. The only thing I will say, there are some issues, in my opinion, that the Pennsylvania Department of Health needs to answer when it comes to oversight of the nursing homes in Pennsylvania.
Commissioner, I certainly can't answer for why DOH or the governor has elected to undertake a strategy they didn't undertake previously. I can make some assumptions about the difficulty of the availability of testing. And I would also illustrate that folks need to realize that the statement that the governor and the Secretary of Health recently made about testing in skilled nursing facilities makes clear that that's going to be on an ongoing basis. So it's not just that they're going to go in and do testing on people, they're going to do testing and then are committing to retesting people on a weekly basis, because that test is really nothing more than a snapshot in time.
Right. Thank you, Brian. Does it do any good to call or email your office and just say we support your push to reopen? I'm going to let all three commissioners answer this. Does that help you know the citizens of Berks County support you? Commissioner Barnhart.
Sure. Have I been able to get back to all our voicemails? Jesse does a great job of that for me. I've looked at many of the emails and responded to some that I've gotten an opportunity to respond to, but yes, we want to hear from both sides of the issue and the argument. And I was saying to Commissioner Leinbach this morning, some of these emails we receive are quite detailed and interesting, and I learn a lot by reading some of these emails to kind of fortify my feelings about certain things. So keep them coming. I have no problem receiving them. Thank you.
Commissioner Rivera.
I have to agree with Commissioner Barnhart. I've received over 100 emails in the past couple of days, and I've done my best to read them and answer all of them individually. Received some calls as well. My executive assistant, Barbara, has taken many of those calls and either passed them on or replied to me, but I do like to hear from the people, especially when they have well thought out points of view, which can help educate us and help us learn about opposing points of views, because it's not about, just angrily lashing out. It's about helping us to understand what your point of view is and why you look at it that way, because that helps us when we're making our decision. So I do appreciate the emails and the calls that we get. And like I said, I try to read through all of them and answer most of them if I can.
Thank you. I will say the same. However, part of me wants to say no more emails, no more voicemails. It literally in the last 3 or 4 days, I have been completely overwhelmed. I've prided myself in the 12 plus years I've been in office to try to be a person that returns phone calls, returns emails, and that has become an impossibility to do with every single call, every single email. I'm getting messaged on Facebook, messaged on LinkedIn, and doing the best I can. But I will give you a pointer. I'm much more interested in hearing your personal experience, pro or con, than I am hearing the same talking points over and over and over again. I want to know how you're being impacted and why you think what you think. It's pretty, you might not realize this, but when you start seeing emails and you see the same phrases again and again and again, and they're unique phrases, it's not the personal things that we're looking for, but those personal ones really do grab our attention. There's a note here, Governor Wolf didn't make up his own guidelines. The PA guidelines are based on exactly the CDC guidelines. Wrong. CDC didn't dictate which businesses were life-sustaining and which were not. That was determined by this administration, and that is one of the things that we are challenging. That's not a CDC guideline. CDC guidelines dictate how a business should function, and to a certain degree, the congregating of numbers of people. Sam, again, where is the guarantee that all business owners will follow the guidelines and that more damage won't be done by those who are irresponsible and not held accountable? At the end of the day, we live in a free country, and we have the freedom to walk out of a business that isn't following it. We also, and John Adams wants to know this, if you have a business that is blatantly disregarding the rules, email John Adams at jadams@countyofberks.com. He's asked us to tell people to do that. And he will work with the local police and or detectives or Pennsylvania State Police to look into that business. We just gave you an example. So there is ability to be accountable, but at some level, each of us need to take the responsibility and be accountable. And that includes big box stores and grocery stores. Is there a way to contact the governor directly? If one of my, I don't think about an email or anything, but if you go to the website, in fact, Google, contact Governor Tom Wolf, I believe the first link you get will take you to his contact page. But no, we haven't been able to reach out and speak to Governor Tom Wolf directly. So it might even be harder for others to do that. This is from Ed. Do you have an indication from the governor that he will be moving Berks County to yellow phase on Friday for May 22nd? It seems he makes these decisions on Fridays. I have no idea. I really don't. I don't know when the governor makes these decisions. I don't know how he makes these decisions. And it's part of the problem. There hasn't been a collaborative effort to talk to counties and say, here's what we're doing, here's why we're doing it. Does this have an impact on you? That's unfortunate. Chris from Reading, I asked last Thursday and didn't get a response. Boy, this is a great question, Chris. And we really didn't talk about it. Will you create a loan program for small business? Other areas in the state have. Two pieces here. In a minute, I'm going to turn it over to Commissioner Rivera, who is leading an effort that's already underway. But part of the CARES money can be used for an economic recovery effort for our county. We have already spoken to the Chamber Alliance about working with us and very possibly taking the lead to work with our businesses, focusing more on our small businesses on economic recovery. So the answer, Chris, is absolutely we are. And for more information, Commissioner Michael Rivera.
Yes, Commissioner Leinbach, thank you very much. And the county right now is working on a small business loan program. We're expecting to have applications ready probably within the next 3 to 4 weeks to be able to start processing them. The guidelines are the loan amounts will be between $2,500 and $10,000. And there's certain guidelines there that will be out. We will be sending out a press release. The loan funds will be handled by a third party. They will be handled by Neighborhood Housing Services. That keeps the county out of handling any of that money, puts it in the hands of an independent third party to do that. This loan will be open to all businesses within the county except for the city of Reading. And the reason for that is because where this pot of money comes from, which is in part from CDBG, which is a federal grant, the county gets an allocation for that and the city gets an allocation for that. So the county part of that cannot be used in the city. The city part cannot be used outside of the city limits in the rest of the county. But the city as well has 2 loan programs that they will be starting as well for businesses that are located in the city. Once we're able to get the CARES Act money, that will also free up more money that we will be putting into small business opening and helping the economy get back to where it needs to be at. Right now, we're looking at starting out with anywhere between $2 to $2.5 million to start out that small business loan fund. So stay tuned. There will be more information coming out of that on that in a week or 2. But yes, it is something we've been working on for about 3 to 4 weeks now. We want to make sure that the money is available for those businesses who have fallen through the cracks with the federal monies that have been out there, such as the EIDL and the PPP. We understand that certain businesses do not qualify for that or have not been able to get it, and that will be the focus of these loans.
We're going to go to closing comments now, and I want to recognize Commissioner Kevin Barnhart, our Vice Chair, for your closing thoughts.
Thank you, Commissioner Leinbach. I appreciate everyone's attention here this afternoon. We went, I guess, an hour and a half, which I think was very fruitful and productive. I do like the positive comments, the concerns in our community. And trust me when I tell you, we are engaged here as a Board of Commissioners. We are dealing with several aspects, not the least of which is, again, I mentioned earlier about bird dogging the CARES Act and the money that should be coming to Berks County. We're working closely with Helping Harvest and what their needs might be in the long term. Mentioning election services and the struggles they're going through. So it seems like this team has really gelled, Commissioner Leinbach, Commissioner Rivera, and myself, really taking segments of this COVID-19. And there's no playbook, as many people have said. And this meeting was about lives and livelihood. And we're all engaged in this. And we really do appreciate any positive comments or directions you'd like us to take, because we can't do it alone. So we appreciate the people in the community here working with us, and please stay safe and hug your family when you get home. Thank you.
Thank you very much, Commissioner Barnhart. Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. I want to thank all of you who have been watching us here. I want to thank the press for covering this as well. I know we answered a lot of questions, and I know there are a lot of questions still unanswered. But we're looking at doing this once a week and covering the questions that we were not able to cover today. So please stay tuned. The goal is to be able to do this next Wednesday as well for as long as needed. But just keep in mind one thing. It's not about opening arbitrarily. It's about opening in a way that will keep the business employees, the clients, and the residents safe. I know we talk a lot about essential businesses versus non-essential businesses, but I go back to my question. Is a business that is deemed essential and they are open, because they are deemed essential, does that mean that it is safe to go in there because they are following all the proper safety and health guidelines? Not necessarily. Can the small businesses that are not open following safety the proper health and safety guidelines? Yes. So what is the difference between a business that is considered essential versus non-essential if they are both following the same health and safety guidelines? One thing could be the big box stores will have more people in them. The small businesses will have less people in them, which may mean more social distancing, less people there, so it may be safer. Just please keep that in mind. We're not looking at doing anything arbitrary. We are following CDC guidelines. We have been asking our businesses to do that for weeks now because we understand that everyone has to do their part to help stop this spread. Not just the businesses, but each one of us have to do our part. And the business owners, I know, are willing to do their part as well. And if they are not, like Commissioner Leinbach said, you walk in, they're not doing what they're supposed to, turn around, walk right back out and go somewhere else, because we are all in this together. We all need to work together to make sure that as a county, we can come out of this the quickest way possible and the best way possible. So thank you for all that you're doing to help stop the spread. And please let's share this message that we're all in this together and that we all need to do our part to be able to move forward.
Thank you very much, Commissioner Barnhart and Commissioner Rivera. I want to thank all of our guests that participated, shared the story of your business and the story of your industry. I want to reiterate, we are not talking about putting lives at risk. We, as much as any other county in the Commonwealth, have focused on doing the right thing, following the CDC guidelines, following the Department of Health guidelines. We believe that businesses that can open and implement effective health and safety standards according to the CDC or OSHA should be able to do so. We think that while it is absolutely a tragedy that lives are being lost to COVID-19, that people are ill and being hospitalized, number one, that curve has been flattened in Berks County. I showed you the chart from the Pennsylvania Department of Health that shows that no other county over the last 2 weeks has done more to drop their case numbers than Berks County. We're doing the right thing, but we're also doing the right thing by advocating for the small businesses, in many cases, who are already doing or able to do the same type of business that the big box stores are doing. And I want to ask you a question as a viewer, as I asked Governor Wolf. What will Berks County look like when we come out of the COVID-19 crisis? Will there be fewer small businesses? I can tell you the answer already is yes, because several of them have already closed permanently. The longer we go, the more closures we will see. We need to open up Berks County responsibly and safely. Thank you very much for joining us on this press event. We do plan to have another one next Wednesday at the same time, 3:30 p.m., and we'll send out more details as we get closer to that date. Thank you, goodbye, and God bless.